have a storm coming in, so we need to kind of move things along. He doesn't want me to introduce him. Dr. Rushnak is a retired physician, and he has survived lung cancer, melanoma, was almost a paraplegic, and he was surviving. He's a survivor because he had health care insurance to cover him, and it was preventively found. These things would never have been found had he not had insurance to go to a doctor on a routine basis. And that's what it is. We can't depend on ERs. Anyway, he's also the co-founder of what? I'm sorry, I can't read his writing. Americans for Healthcare. And he's also the co-founder of Millions Marching for Medicare for All. It was actually his idea that we start this march on this day. My friend.
I must be crazy. That was my idea? Really? Okay. All right. What I'm proud of is that all the volunteers across the nation, 45 states, 60 venues, all volunteered to have marches today. By the way, much larger than this. In their own states. My home state of New Jersey has 2,000 people today. And New York City at Union Square, there's also several thousand people. So Margaret Flowers, D.C. is tough to do this. I'm a survivor today, and I could just lay back and just say, well, I got health insurance and hope that God will take care of me. But I'm not doing this for me. I'm doing this for those people up there. See those people? See those young families, those young children? Gee, I was once young children, right up here on the banner, right above here. And you look over here, there's more kids. I have 7 grandchildren. 7, they're the greatest, make life worthwhile. You know what? Your grandchildren are in big trouble. Your children are in big trouble. You know why? Because you're not active. You're not as active as you need to be. Look at this crowd we have. We should have thousands here. Where's millions? Where are the people who don't have health care? Why aren't they involved? Well, they're working today. And tomorrow, Senator McConnell, where's your office over there somewhere? And Senator McConnell, I think, is going to introduce a bill to repeal Obamacare and replace it either with nothing or some health savings account if you're a multimillionaire and you can afford it. It's disgraceful. President Lincoln said public sentiment is everything. With it, nothing can fail. Well, I can tell you that the times are changing because President Lincoln is wrong today. Because President Lincoln said, if you have public sentiment, nothing can fail. We have public sentiment. 60% in polls show that they want single-payer Medicare for all. 60%. Do you know how much want Trump care? 15%. Obamacare has bad numbers. They're not affordable. They're insurance. They're not health care. We don't have a health care system in America. We have a sickness care system in America, all based upon insurance so they can make profits off of your sickness. It's not health. It's sickness care paid for by insurance. Remember that. You do not have a health care system in America. So, and it's not a political football. Next person who tells me, well, you Democrats or socialists or progressives or leftists, whatever name you want to call. No, it's not. Everybody is a human being. Everybody can get sick. All ages, by the way. That's why we call it Medicare for all, because young people are not invulnerable. Car accidents and all sorts of drug overdoses and suicides, etc., that leukemia. You can have things happen in your infancy. When Leslie Boyd spoke before, she was absolutely right. Don't tell me you're pro-life unless you tell me you're pro-life until the grave. That's when pro-life ends, after you die, not before. So to say that a baby or a young child does not deserve health care, what do you expect the baby to do? Go out and get a job? I've heard politicians say, oh, well, they haven't worked for 3 generations. I guess he means the infants out there who haven't got a job. I think we have child labor laws against that. I mean, the things they say behind me is disgusting. I will never return again, mark my words, to Washington, D.C. When my wife and I drove into this town last night, I felt dirty. This place is not what was used to be. When I came here with my children years ago, we had hope that we could come together as a people. These people behind us have polarized us because we go on Center for Responsive Politics. Look at the money they get from big pharma, big insurance, big hospital systems, millions, tens of millions of dollars. These are the people getting tens of millions of dollars. Look at them. They're in their offices now. By the way, they have the best health care in the world, but they don't want to give you any health care. Why is that? Because they don't think you're equal to them. It's almost like you're the subjects. Remember when we had King George? What happened when our country was first founded? We had taxation without representation. We were called the subjects of King George. My God, the subjects? Are we citizens or what? Are we Americans or what? Before you were ever considered to be a party, a Democrat, Republican, you were an American, okay? So we are American first and American last. We are all Americans who need health care. Let us put aside this divide we have amongst each other. It's something that the mainstream media and the people behind me have created, that health care is a political football. Let's stop throwing around healthcare like it's a football. It's not. It's something we all need, and it's something we need to come together. I don't mean just a couple of hundred people here and there. I mean millions, tens of millions everywhere. There should be no stopping this. Okay? There's no way that 300 million people will take being subjects of the politicians. That's ridiculous, and for them to assume that we will not fight back, that's the reason why we're in the predicament we're in now. They take it for granted that we will not gather together, that we will be not united, we will be divided. Divided party against party, state against state, South versus North. That's not true. We're one people. We're the American people. Our preamble says, we the people. It doesn't say we, any particular party. It says we the people. Well, it's about time we get our unalienable right to life, liberty, and the pursuit of happiness. Whatever happened to that? We demand that. We demand that back as citizens. Otherwise, let's all get out of this country because it's not the country I grew up in. The country I grew up in believed in that. We had FDR progressivism. We believed that the government was there to serve the needs of the people. Right now, the government seems to be there to meet the needs of the special interests. The special interest donors who give them money to get reelected. The only thing they know is getting reelected. They crave power. And until we stop electing them, so therefore support Justice Democrats, people over corporations, people over politicians, and support brand new Congress. That's what we should do. So let's all get together, Americans, and say, yes, we want single payer health care. Let's go. Yes, we want single payer health care. Tell Congress, yes, we want single payer health care. Raise your fist. Yes. Health care. Yes, we want single payer health care. Listen to us. Yes, we demand single payer health care. And when do we want it? Now. When do we want it? Now. We want to live. We don't want to die anymore because people don't have the money to survive. Thank you very much.
It is with great disappointment to work so hard to want to bring to you Representative Conyers and Nina Turner. It is such a disappointment to tell you that we've got 60-mile-an-hour winds, an hour-long rain coming, and we're going to have to shut it down. But please go to our